injecting the device, right? And again, letting it go to organs, isolating the organs, and then looking for the presence of the device. And again, the non-targeted device, right, compared to the targeted device where we could see it, you see signal present, right? We saw a lot of signal compared to nothing, and then we see signal again compared to the non-targeted device. Okay, so it looks like you can target the device at the receptor. You can target it at cells that carry the receptor. And then if you look at tumors inside of mice that should again have the receptor, you're seeing that you could isolate the tumors and light them up. So those are kind of looking at can we get to a target? Might it be working? And when you looked at TEM initially, we started seeing, without staining, you started seeing these blips that were not normally present compared to the controls, which were the gold components of the devices. So it looked like you could use transition electron micrographs to begin to look at intracellular distributions. And we'd always see them leave the interstitium. The interstitium was always blank, and then they would go out into these cells with TEM. So we began to think that we might be able to use TEM. The more we used it, the harder it became to use because it's so laborious, it's so tedious to use TEM to follow these things intracellularly and where they're going. So even though we started in on TEM to try to look at intracellularly at these things, we wanted to adapt other technologies. I'll get to that in a sec. The other thing we tried to look at was where do these things go intratumorally, that's what I was talking about, and we used the technique of trying to do sections, right, through a tumor and look at adjacent sections, and Daryl Nazareth had worked on some of this with us as well, who's speaking at another talk here actually. And in one slice, look at the radioactive isotope for the device. Again, this was worked out with copper-67 and using